Testing demand across North Texas is surging. Some of the community testing sites in Dallas County are having to turn people away. The emergency manager for Dallas says it's because more people need tests and resources are being stretched thin. To explain it all, Fox 4's Allison Harris in tonight. Allison.
Steve, these public testing sites are testing as many people as they can, but even still, they're unable to use hundreds of tests. Public testing sites in Dallas County are turning away people as demand for testing increases.
Sorry, based on the number of cars ahead of you, you're going to be the last car, and we have to turn people away.
Dallas has the ability to do nearly 3,000 tests each day at its public testing sites, like Ellis Davis Fieldhouse, City Square, University of Dallas, and Paul Quinn College. The demand is there, but Dallas Emergency Management Director Rocky Vaz explains that there are hundreds of tests that can't be conducted because of a shortage of staff.
Which is staffed by Parkland, and they're stretched thin right now too.
Testing is happening in parking lots in the heat of July. And while Parkland is a large health system, the hospital doubled its COVID ICU units over the past week.
We have to have sufficient medical personnel so that people can take a break every now and then.
Another problem is that these public testing sites are taking as many as 10 days to return results, according to Dallas County Judge Clay Jenkins. The nation's largest testing labs, LabCorp and Quest Diagnostics, warned this week about delays in turnaround.
It's hard for you to make your best medical decisions, and there's an 8 to 10 day turnaround for your test. And it's hard for us to trace those who you've been in contact with and help keep them safe if we don't know what's going on for 8 to 10 days.
The testing site at Paul Quinn College is pulling in people from all across DFW. College President Michael Sorrell tweeted Tuesday, 100 cars were lined up before we opened and we ran out of tests with several hours to go.
We're not typically a country that has supply chain problems. Like, we're certainly not a country that should ever have supply chain problems. What is it about this moment in time where those systems are breaking down? Because we have to be able to have people tested.
Dallas could certainly do more testing, according to Vaz, who reminds us that federal support for testing sites ends on July 14th, unless there's another extension. The new testing site at the University of Dallas is already being run by a private vendor, paid for by money from the CARES Act.
Testing is extremely expensive. We're talking at the private vendor side, it's up to $140 per test.
Dallas's public testing sites should be able to do all of the nearly 3,000 tests that are allocated to them within a few days. A spokesperson for Parkland tells me that they are not hiring more staffers to staff those testing sites.